She said, oh, you know, I won't talk until I've done the scan. And I just knew. And I really wish I hadn't have had the screen in front of me, seeing it all.
What could you see?
I could see, well, I think it was the baby, but, and then that's when they say, oh, you know, very sorry, there's no heartbeat.
When our health falters, the impact can be dramatic.
What is it? Tell me.
I just hate it so much.
But often, it's our partners and our loved ones that suffer just as much.
It's almost like having a third person in the relationship.
How could you want to look at that and be attracted to it?
Are you here alone?
Yeah, by myself, really.
With top in-house specialists on hand to treat his patients.
Lean back towards me.
Okay.
Good morning. How are you?
World-renowned Dr. Christian Jessen has set up a state-of-the-art clinic to give people from across Britain the kind of care that sometimes fails to reach them.
Nice to see you.
I'm just hoping Dr. Christian can make my life happier.
Oh, that's why I love my job. Why were you bullied?
I was bullied for a lot of reasons. Good 10 years of my life it's been happening, and I suffered like...
It's okay, it's okay. It's good for you to talk about.
Every step of their journey will be captured as they share their most vulnerable moments and intimate problems, in the hope of solving issues at the very heart of their lives.
I've got that one at the front there.
Every day I think about it. Something has to be done.
I'm scared I'm going to die.
I'll have the opportunity to talk to partners, to mothers, to daughters, as well as the patient themselves, really to try and pick up all the pieces and to address the sometimes very complex emotional problems that come hand in hand with the underlying condition.
As cheesy as it sounds, I feel really light and positive.
There's actually hope.
So, ladies, how was your evening?
Well, I'm a bit weird. I do DIY.
Do you?
Yeah, like making wardrobes, have my own toolbox.
Really?
Yeah.
Oh my God, not like, you need to come to my house.
I can do anything. I look really puny, don't I?
Yeah.
I'm a strong woman, you know, so... Hello. Please come in. Thank you.
My name's Greg Slocum. I'm 52, ex-forces. I'm now a professional tattoo artist. I live in Lincolnshire, originally from Cardiff.
Hello.
Hiya.
How are you both?
All right, thank you.
Good, thank you.
Can I have a surname, please?
Slocum.
Can you please sign in for me here?
Yeah, certainly.
There you go.
I met Greg in a pub and got him drunk, basically.
So, pop your feet on the metal plates. Lovely.
His eyes attracted me to him. I don't know, there was just something there. He looked like a little lost puppy.
Keep perfectly still.
My friends kind of think I'm quite macho. I had this kind of reputation in the army. I was coaching martial arts team, the boxing team, the rugby team for the regiment, but now it's taking its toll on my body. I'm falling apart now.
Are you familiar with this machine?
Yeah.
Yeah?
The pain has been absolutely brutal. You can't walk, you can't sit.
Oh, look. Fabulous.
I really need to get back to work. I've had to take out loans just to pay the rent on my tattoo studio. I can't see it get any better. So this is my last-ditch effort.
Come in.
If Dr. Christian can't do anything for me, then that's what I worry about. Will I be stuck like this forever?
Oh, very nice to meet you. How are you?
Good, thank you.
Come and have a seat for me
Thank
here.
you. Cheers.
Take your time, actually. Sit yourself down. And then...
Excuse my slowly slumber. It's
No, I'm already sensing what the problem might be.
over 20 years military, so I'm pretty good with pain. But this has gone to a whole new level. It's just absolutely ridiculous. It started with a simple ingrowing hair right next to my anal canal, which turned into an abscess. and then they've just become reoccurring abscesses, which has progressed into a fistula now.
Yeah. An anal fistula is really a connection or a canal between your rectum, between the bottom, sometimes even the very outside of your bottom, and the inside, the gut wall on the inside. They can be extremely painful, they can become infected and discharge pus and blood, and also they can spread, they can branch out and become really quite complicated structures that can be very, very difficult to treat indeed. I know, just looking through medical records and things, you've had lots and lots of things done.
It gets actually infected and it turns septic. So I've had 3 emergency operations.
And you get a sort of build-up of pus and things in there?
Yeah, pus and blood. And it's got that excruciating. I've tried to cut them with Stanley knives and all sorts, just to relieve the pressure. I know.
Don't do that. Please don't do that.
I know how it sounds now, but it's got that bad, just to relieve some of the pressure and the pain. I've literally been on my back for 10 months because I'm either pre-op where it's infected, post-op where it's the gaping hole they've left, cutting everything out, being packed and prodded every day. So it's literally, it's ruining my life. I can't do nothing.
Hello. Hello. How are you both?
Good, thank you.
Can I have your surname, please?
Yes, Reese.
Can you please sign in for me?
Thank you.
Take a seat.
Thank you.
Are you two married?
No.
Oh, I thought you were.
No.
Together?
We're together, yeah.
Okay.
We met in a pub in London. And just, went on a few dates.
I just got talking to her and found her attractive, and then off we went.
Everything happened so quickly. I found out I was pregnant 3 months into the relationship. It was like, oh wow,
I love being a dad. I mean, it's what I go to work for, and also Becky. It's why I come home.
Where are you two coming from?
Hertfordshire.
Hertfordshire, that's not too far. Kaz lives really, really, really far away.
I'm a country bumpkin. I don't like crowds and busyness. I prefer hills and ponies and sheep and stuff.
Yeah, fair enough, yeah.
Who's at home with you? Is anybody looking after you?
Yeah, Kaz, my girlfriend.
Yeah.
She's just been an absolute legend. She don't deserve this. We've been together about 4 years. She's a beautiful person on the inside and out, and she's constantly looking after me. We don't even sleep in the same bed. We can't because she sort of twitches. We haven't been intimate for like 10 months because it's just too painful. It affects every aspect of my life. Every single facet of my life is just on hold, literally. I hate the fact that I'm like this.
It's okay.
Oh, sorry. I literally can't do nothing from being, the provider and the soldier and all the rest of it, and all of a sudden I'm just useless, just laying on my bed. It's just, it's on a downward spiral, and it's getting pretty bad.
I understand. All right. Okay.
Sorry.
It's all right. Don't worry. You're allowed to cry. Here. Nothing wrong with that at all.
I really like your tattoos. I noticed. I was like, oh. I want a tattoo, but I'm really scared of the pain.
Most of them are not that bad. It's
Okay.
just certain places hurt more than others.
What places hurt most?
Your chest.
Oh,
Yeah,
right.
avoid that like the plague.
This is the first I've sat up for 10 months. Yeah, it's been a nightmare, to be fair. It's been a real struggle. I've been led to believe there was all these different tracks of infection tunneling off from the original one.
Yeah.
So I don't know if there's one of these little tracks they're missing or not doing, because it just keeps coming straight back.
I'm not going to presume to be able to give you answers yet before we have really sort of had a look at what we're dealing with. Now, I'm not going to have a look because I am not the best person to have a look.
Okay, brilliant.
Because I'm not a colorectal surgeon, but I have a colorectal surgeon I'm going to get you to talk to. I'd also want to do an MRI scan now to get a really detailed picture of where we are now. And then I hope we'll be able to give you some answers. Is that all right?
That's absolutely brilliant.
I mean, let me get you back to reception. Let's get that done first, and then we'll talk a little bit more.
Brilliant.
All
Thank
right.
you. Yep,
But
fantastic.
take your time. Don't rush anywhere. All right.
Okay.
Please don't.
Thank you very
There's
much.
no need.
Brilliant. Thanks very much.
Okay. Turn left down there to reception, and then you'll be off for your scan.
Brilliant.
Okay.
Thank you
And
very
we'll
much.
see you again.
Thank you.
Hello.
Yeah, right.
All right.
I'm pregnant.
You're pregnant?
Yeah.
Congratulations.
Thanks. Oh, I gotta go for an MRI scan.
Hello all.
Hello.
Rebecca, Colin. Come on
Right,
through.
see you in a bit. Thank you. Cheers.
I had no idea that trying for a second child was going to be this traumatic because
No.
the first one was just, well, Elliot was just...
It was easy from start to finish.
It was...
We were lucky. It was very easy. It was didn't have to think about anything.
So, what can I help you with?
We have a child, and that pregnancy was great, very textbook. And then in the last year, we've had 2 miscarriages. With the first miscarriage, of course, didn't think I was ever going to have a miscarriage, didn't know much about miscarriages. It was really quite traumatic. And then we found out we were pregnant again. So that was great. But I was worried that the same thing was going to happen. And it did. It happened in the same kind of way.
I mean, it's clearly very, horribly, horribly devastating for both of you. And I really sympathise with. How are you two getting on with it all?
It's been... My whole thing was when we had the first miscarriage, I'd never seen Becky that upset and that distraught and everything. And the whole thing was basically making sure that Becky was all right and also that Elliot wasn't getting affected by what was happening.
The second one hit you worse than it hit me.
I thought the second one was going to be a goer. I thought we was all okay with that one, but it didn't. And that one hit me because I was confident that I thought it was going to go to the term. But
why were you confident? Just because
I don't know,
couldn't be
just
more
the
than one?
feeling.
Yeah, the feeling.
Just the feeling. I just had this feeling.
Is my cycle dropping off? I've just turned 40. Is it an age thing? And it's now just the fear of going for it again, having another miscarriage. We do want another child.
Yeah, definitely, yes.
From having a first easy pregnancy, what is going on now to 2 miscarriages in a row kind of thing?
One thing I can't stress enough is that the more you're stressing about it and every day that you're worrying about it, the less likely you are to get pregnant.
Yeah.
All right?
Yeah.
Sometimes there are definitely underlying medical causes that makes carrying a baby to term very difficult.
Right.
And your age does slightly increase the risk of these things happening. Not because there's any problem, simply the, advancing age is the factor. I'm very happy for you to, have a chat with a gynaecologist.
Okay.
What I think they will be able to do is initiate some tests and things for you as well. See how you go for a bit after that,
Definitely, yes. My hardest thing has been seeing Becky go through this. It's very hard to watch. That's probably the hardest for me.
Hello.
My name's Courtney, I'm 28 and I'm from London.
Hello, ladies. How are you?
Yeah, good, thank you.
I work for London Ambulance in the call centres. I've got 2 children, youngest is 3 and the oldest is 8. Here we go, celebrity hair, 43. I do spend the majority of my life at work, but when I am about, then I do a lot of things with the kids, outdoors. We try to spend time as a family together.
Where are you two coming from?
South East London.
Oh.
I drove up from Bournemouth.
Are you sisters?
Yeah.
Oh, right.
Yeah.
You live far away from each other.
I'm moving back though, to be closer to her.
Oh, that would be nice.
Yeah.
Do you live home with mum and dad?
No, we're both married off now.
You're both married?
Yeah, we're
No
dinosaurs.
way.
Yeah. My condition's got to the point now where something has to be done. Every day I live my life, I think about it. I haven't got the confidence to show my husband and stand in my full glory and be like, well, this is who I am, because I don't think it looks pretty.
Would you ever get like plastic surgery?
No.
I would get it.
What would you do?
I would get a bit of a nose job. You know, like my side profile?
Yeah, what's wrong
It's
with
really
it?
bulbous.
Doesn't matter.
Can you not see the
look
bulbousness?
great. You see, we're never satisfied, are we, with the way we look? We always want something that we don't have, and people will go to extreme extents to do all sorts to their bodies.
I saw one guy, he put cement in his bum. A guy.
Cement?
Yeah, to have a big bum. A donkey.
No.
Yeah.
Was this on TV?
Yeah.
Cement.
Cement.
So you've had the 2 miscarriages and the 1 successful pregnancy, and you're now hoping to get pregnant again.
Hoping to get pregnant again.
And hoping that it's going to be a successful pregnancy.
Yeah.
Okay. The most important thing is you had a successful pregnancy.
Right.
So that rules out a lot of issues that may set a lot of people with recurrent miscarriages. If you had 3 or 4, but having had a normal pregnancy is the greatest insurance you've got.
Oh, really?
You're 40, so obviously there's not endless time ahead of you.
Right.
And I guess that's in your mind too.
Yeah.
So probably going forward, we really wanted to do the scan to rule out any cause of miscarriages, which could be things such as fibroids, or then something that's causing ovulation to be a problem, such as polycystic ovaries. Okay.
Yeah. Without having a scan, without having blood tests, it's very easy to think, oh, there's something wrong. It's the unanswered questions that is difficult.
The first miscarriage affected Becky very emotionally. I think it surprised her. I think it surprised Becky on how much it affected her.
I clearly remember going in for the scan and they had the screen up on the wall in front of us. I could see, well, I think it was the baby, but, and then that's when they say, oh, you know, very sorry, there's no heartbeat.
Hello, Angela speaking.
Hey, Angela, I will have Courtney, please. On her own, I think, to start with.
Okay, thank you very much.
Thank you, thanks.
I've been married for just under 2 years. He's quite tall, handsome. That was my first, attraction. I'm the hot-headed one and he's the more calm and collected one, doesn't raise his voice. So he kind of keeps me level.
Graham.
My relationship now is kind of when I get out of the shower, towel comes around me, I go upstairs, quickly get changed, and then I come back all perfect but clothed. And I would like to kind of be able to walk around my husband, without any clothes on.
All right. What can I do for you, Courtney?
Okay. So it's basically the appearance of my stomach. So after I had my first child, he ended up being a 10-pound-4 baby, and my stomach just stretched past capacity, basically. My stomach just looks so wrinkled with stretch marks. I just cover it up, none of my friends know. I don't even show my husband.
He's never seen it?
I've never showed him, but obviously we've lived together for 10 years now, so he'll walk in, if I'm getting unchanged, I'll turn around immediately, cover it.
Really?
Honestly, yeah, whenever I get changed, I turn around.
I mean, if you're intimate with your husband, if you're in bed together, how do you sort of avoid?
I know, it's tricky, and this is the thing, and that's what I mean as well. It's always there in the back of my mind because I want to cover it up. So when we are just kind of spare of the moment, want to get intimate, in the back of my mind, I'm still thinking about my stomach. Even if like he puts his hand on it, I'll move his hand.
Really? Is that straining things?
Yeah, like, because I'm just lack so much confidence, yeah.
All right. Look, I think before I go on and talking about it more, I ought to see what it is that we're talking about, obviously, before I can really say anything. Why don't you just come and stand over the couch, because it's... Lift your shirt up. Are you all right with me doing that? Sorry. I'm just going to tuck it under there. Okay. Can I get you just lying on the couch? I just want to have a look at the muscles of your tummy as well. Why don't you lie on your back on there? Just lift your head up and look at your feet for me. That's fine. What I'm doing there is sometimes with pregnancies, the muscles, the sort of strap muscles, you know, the six-pack muscles can become very, very stretched apart. Yours are okay. It's frustrating in medicine when you're often asked to treat things that aren't abnormal particularly, and yet society for some reason has made them abnormal. That idealised image of women, celebrities tweeting their post-baby bodies, puts tremendous pressure on new mums to look exactly that way, which is completely unrealistic and I think is a source of a lot of distress for women. The bit that you don't like
It's all that bit, yeah.
is that bit, and in fact, you can't really see now, but when you're lying down flat like that, looks like a very good tummy to me. Let's get you to sit down. Come and sit back down there and I'll talk to you more. I mean, what I'm struggling with is that in many respects, to me, you don't have a significant overhang. It does look very much like a tummy that's had babies, but not by any stretch of the imagination the worst that I've seen at all, you know. Why are you crying? Tell me, why are you crying? What is it? Tell me.
I just hate it so much.
It's what?
I just hate it so much.
Okay, look, here's some tissues.
Like, I'm always like the most confident person.
What about your family? Have you got brothers and sisters?
Just one sister.
You've got one sister. Has she had children?
Yeah.
And what is her tummy look like?
Perfect.
Perfect.
Oh, because she hasn't got any stretch marks and she hasn't got any wrinkles.
All right, well, look. I'm going to do this for you. I'm going to let you go and have a chat with the plastic surgeon, with the cosmetic surgeon. All right? A chat.
Okay.
But I want you to be very, very aware that surgery comes with considerable risks. It goes wrong.
Yeah.
You know? You can bleed, you can get infections, you can die sometimes. It's rare, but it's a big deal. And I want you to really think and weigh up those risks. And the fact that you've got children and things like that is, do you want to put yourself through that for this?
Yeah, okay,
Yeah?
thank you so much.
All right, let's take you back to the waiting room. Don't tell them I made you cry, all right? Tell them I'm lovely.
I will, thank you.
See ya.
Hello. You alright, sis?
Yeah.
You okay?
Yeah, good, thanks. Can you sort my makeup out? Can you sort my makeup out?
It's not a male thing to do, is to meet up with your friends down the pub or go to work and go, "Hi, how's your day? Yeah, oh great, yeah, we had a miscarriage yesterday." It's just not part of the conversation, you know. A miscarriage happens and that's between you and your partner, you know.
Hi guys, let's follow me into treatment room 2.
You know, I've lost kind of that connection and trust with my body as well. You know, what's going on? Why is this happening? You know, and we were very lucky. We had a first healthy baby. What's happened since? What's gone on now in those 2.5 years since having Elliot? For now, 2 miscarriages.
Hiya, how are you doing? How do you?
Hi.
Okay, shall we go through those results then?
Please.
So you had the scan. The conclusion says both ovaries appear normal, with cysts or multiple cysts, but these are in the normal range.
Okay.
No evidence of polycystic ovary.
Great.
So that's a perfectly normal
Great.
scan. And they even say the cervix appears normal.
Okay.
It will have no impact whatsoever on the pregnancy. So going forward, you've got a normal scan, nothing to account. The miscarriages we think are not really relevant.
Okay.
You've had a normal, healthy child. That's the best thing. 40 is really the new 30 in obstetric
Sure.
terms,
Yeah,
so there's
yeah.
no need to worry about
So
it.
that's good, yeah. Take that out of my
so
mind.
you needn't worry about it. Because really, what you've got to avoid is letting the psychological impact of it get you down.
Yeah, that's been so hard.
And yeah, to a certain extent, it's affirmation that things are all right. But the statistics are all in your favour, honestly.
Okay.
Again, the fact that you've already had a successful pregnancy suggests that you will be fine.
Okay.
But of course, to you,
Yeah.
it's a big
I think it's
issue.
just wanting that reassurance, and to hear it from a specialist like yourself is that added insurance to maybe not to stop stressing as much as I have been and stop the worrying.
Yeah, it's natural to have the stress, but really you do not need to.
Okay.
You know.
So, thank you very much.
I'm sure you'll be fine.
Thank you.
I can't give you an absolute guarantee, but I can almost give it to you.
Thank you.
Look at that smile. Look at that. That's the first time I've seen a smile like that for about a year.
Nice to meet you.
You too.
Okay.
Thank you. Thank you very much.
Good to
Cheers.
We had really good results back, really positive.
Okay, cheerio.
Bye-bye.
Bye now.
The reason for doing this is more of like it was a massive emotional thing, wasn't it? It needed someone to tell you it's okay, it's not you, it's not us.
Hello, welcome. How did all that go?
Good.
Did you get some questions answered or?
Definitely.
Yes?
Yeah.
Look at the smile, look at the smile.
Yeah, I
feel,
can see.
I just feel so much better from having the scan and just ruling out anything, and it all being a bit more positive.
Let me just iterate here that the reason we're doing this is, because you are very anxious, and I feel if we
Yes.
can just help calm that down, then you'll be able to
absolutely.
move on.
Absolutely.
And it's not sort of necessarily,
No.
it's not required or standard in that respect,
Sure.
okay? So
No,
that's
it's definitely, I do feel a lot more positive moving forward now.
good.
Yes.
Good.
So
You've
thanks for
had
that.
traumatic events, there is no doubt about it, and sometimes there is no rhyme or reason to it,
Yes, exactly.
I think the most important thing you can do now is try and put what's happened behind you.
Yeah.
Not forget it, but put it behind
Yeah.
you so it is not still affecting things.
definitely.
That nice, relaxed way that you were when the first one came along, it's proof, isn't
More
it?
secret cinema dates and...
Oh, is that how it happens? Right. I see. Good.
Yeah.
Excellent.
Great.
Thank you very much.
My pleasure.
Cheers.
Bye-bye.
Thank you. Bye-bye. Cheers.
All right. Bye-bye.
Thanks.
Bye.
You've just been told by two extremely well-educated professionals that everything's fine.
I know, it's just going to take a while for it to all sink in.
It was lovely to have you here today.
Thank you.
Thanks,
Have a
Anne.
lovely day.
Thank you.
Take
Cheers,
care.
take care, bye-bye.
Bye. Bye.
We'll be having another baby.
My MCA. Hungry.
Yeah, I know. Sorry. Oh, it has been a long day, hasn't it?
I love Greg a lot. He's the most important person in my life.
So what do you want to do after we go and get something to eat?
Yeah, got something to eat.
I'd just love us to go out again and start enjoying life again, rather than just being sat in the house constantly thinking about whether he is going to get better, how he's going to get better, when he's going to get better. We haven't had sex for about 10 months because of everything that's been going on.
Okay, Greg, our specialist is ready to see you in treatment room 1.
Brilliant. Thank you very much. Right. There's 23 years difference between me and Kaz. So I thought, maybe, well, if I can satisfy her in the bedroom, then maybe she'll find someone else. Just, you don't feel like a man. Just feel useless.
Come in. Hi.
Hello.
Is it Mr. Slocum, is it?
How are we doing? Yeah.
How are you?
Good, thank you.
Yeah. Come take a seat.
Thank you. Cheers.
What's been happening?
I basically started 5 years ago with a simple ingrowing hair, turned into an abscess. I had
Where was that exactly?
history right next to my bum.
Okay, so around the anal verge.
Yes,
basically.
yeah.
So that turned into an abscess. Yeah.
This year, it's It's now turned into a fistula. So I wasn't sure if that tract is the only one or if it's leading off somewhere.
Hi, hello, sister. I just want to examine Mr. Slocum. So what I'm going to do is, Mr. Slocum, are you able to get up on that couch?
Yeah,
It's a bit high.
yeah.
You lie on your back first, and then...
What I'm going to do first is just examine the area, if you don't mind. Just relax. Okay, let's remove this swab and pop that in the bin. Okay. Okay, let's just have a look. So what I can see, yeah, you clearly got a seton in place.
A seton is one of the ways that we treat anal fistulas, and it's essentially a sort of strip of rubber or plastic that's threaded through the fistula canal and it's left in place, and it helps fluid, any infection or pus to drain, but also it gradually works its way out of the fistula, cutting through, and the fistula heals up behind it.
And the abscesses occur right next to it, don't they?
Right next to at the head of the seton, yeah.
Yeah, the tract looks quite clean. There's no other stigmata. Just relax yourself, that's great.
Until it's broken, you will never know how much you use your sphincter muscle. Everything moving, coughing, sneezing, literally anything, you don't know how much it hurts.
I'm going to just examine you internally, if you don't mind. Is that all right?
Yeah,
if
fine, thanks.
If it's too painful, tell me and I'll stop, all right? Just relax yourself. Okay. That's good. Just hang on there for a second. Okay, I'm sorry for causing you pain. We're nearly finished. Just relax yourself.
The pain you go through, especially after an operation, because it's just raw, open wounds, is something else.
I'm going to just use some gel, just some tissues to remove that gel, all right? Okay.
I just want my life back. It's just, it's killing me at the moment.
Quite cold in here, isn't it?
Are you cold? Yeah, you said. Are you guys cold as well?
I'm all right at the minute.
Yeah, I'm okay. I'm a fat lad. It takes me ages to get cold.
Hi, Greg. Would you like to come through with me?
Yeah.
Thank you. So, take you to do your MRI.
All right. Wow.
The problems with anal fistulas are they can spread by sort of branching out till you have complex networks of fistulas, and this makes them really hard to treat. So I want to do an MRI scan to get a really detailed picture of where we are now.
It's been the worst 10 months of my life. It really has. I just feel useless, worthless. It might be a draconian attitude, but I feel I should be looking after Kaz. I mean, I try and put a smile on my face when she comes in from work, but she says, look, you're smiling with your mouth, not with your eyes.
He likes to take charge and do the things he wants to do, but because he physically can't do it, and I am, it winds him up, I think. It's just hard and awkward because there's only so much comforting you can do without repeating yourself.
How did it go with Dr. Christian?
Yeah, really good. I can see the specialist and see what they say, basically.
Okay.
Yeah.
You feeling hopeful?
Yeah.
Yeah. Oh, good.
Trying to be positive.
Exactly.
It's definitely affected my sister's confidence. Definitely, especially with her relationship with her husband.
He told me worst case scenario. Like, he was like, oh, people die. Like, people lose blood.
Lovely. That's nice. He's actually never seen her stomach. It's hard to believe, but she just covers herself up all the time like an old woman.
Hi, Courtney. Angelica's ready to see you now.
Deep down, she's just so upset and gets really depressed about it. And it's not nice to see.
Hello. Hello.
Hi.
I'm Courtney. Nice to meet you.
Nice to meet you as well.
I just would really love to be able to be back how I used to be and be completely confident in my body. I think it's kind of like my last opportunity to try and do something about it.
Great. Okay. So what is it that you don't like? Tell me.
All of this whole part here, this whole
part,
the skin. So
the skin,
like
right.
all of my belly button doesn't look normal. If you see, it looks like a prune. Like
yeah.
And when I lose even more weight, this goes even more like this and sag.
Okay.
Where I've put on a few pounds, it's filled it out.
It's filled it out a bit more. So pull the tummy in as if you were exercising. So there's a small amount there. Okay. There. So if we were to, let's say, to consider an abdominoplasty, yes, which is the operation that we do after this, the scar would be coming like that. Yes, it's at this level. And this skin is lifted, and then we pull it down. If you have a look, it's a small amount. The overhang is really small. So if we pull it down, it doesn't really affect the area above the belly button.
So basically, there's not enough skin to pull down.
To pull everything down and close it. We're in between, you see. Because the problem
makes it
is
hard, which makes it more worse that it's in between.
Patients build up a lot of hopes and a lot of expectations, and it is hard to essentially say no to a patient who's really hoping to get some sort of surgery, particularly when it's cosmetic or aesthetic surgery. But it is important that we make that decision correctly. We weigh up the potential risks with the benefits, and sometimes the answer just has to be no.
I mean, what I would suggest, there are some non-surgical options that we do to help to improve the skin quality.
Really?
So typically we use radio frequency to improve the area locally. How would you feel about something like that?
I mean, you're the professional, and obviously I value your opinion. So.
Are you definite that you want something done about your tummy? It's not something that you can think about it and say, look, it's okay.
It's definitely something that I do want done. Like you said, it might not be the right option for the surgery if there's not enough skin to pull over. But by all means, I would love to try something, like whether that's radio frequency or another minor procedure. But I definitely would like to try something to help the appearance of the stomach.
Of the skin. I think we can organise that. Maybe that would be the best option.
Yeah.
That's great.
Thank you very much.
Bye-bye.
Thank you.
Come in. Hey, hi, welcome back. Hi.
Hello.
How are you? I'm Christian.
Good, I'm Morgan.
Nice to meet you. So
she said that unfortunately there isn't enough skin to pull down. So she said that she thinks that radio frequency would help to improve the appearance of it, which is something I haven't heard of before.
it tightens up the skin, which is sort of essentially what you want, but obviously not quite with the risks of surgery.
Do you think that it would show improvement by me?
I certainly do. Yeah. I don't think she'd be offering it to you if it.
Really?
Yeah. But
what?
I want you to go home, and I want you to show your husband your tummy properly and openly, and I want you to talk about it with him, and I want you to tell him what you're considering doing, because he must know about it, and he must be part of that decision-making process.
But for a non-surgical procedure, I could show him after, because it's non-surgical.
No, I want you to show him. It's so important. And he may be really worried about this.
Yeah.
I think he should know.
Yeah.
Yeah?
Mm-hmm.
Do you think that's the right thing to do?
Definitely. Yeah. 100%.
Good.
Thank you.
Lovely to see you both. Thank you for coming in.
Have a nice day.
Let me show you out.
Thank you so much. Have a
All
nice
right.
day.
My pleasure. Nice to see you both. Bye-bye. Bye.
He's so lovely, isn't he? I'm going to go home today, and I think that my mindset now, after speaking with Dr. Christian, I will have the confidence to show my husband my stomach.
How did everything go?
Yeah.
Good?
Wow.
Yeah, really good, thank you.
Happy to hear that.
We'd be there walking around the house naked.
Are you guys nervous?
You are, right?
Yeah, my blood pressure was a bit through the roof.
Don't be nervous.
Come in. Hi.
Hello.
The purpose of the MRI scan, as you know, was to identify the primary tract.
Yeah.
If you look here, what we can see, and the good news is that there's only one single tract. There are no secondary extensions, there are no abscesses elsewhere, which corroborates with a clinical examination. In my opinion, I don't think this is going to migrate much further, so I think we need to think about the alternative strategies. No treatment is 100%, but it may allow you to progress with your life and have a more comfortable bottom without a seton in place.
Just to get back to work would be amazing.
Is that all right?
Fantastic, absolutely brilliant. Thank you so much. Thank you so much.
Thank you very
Really
much.
appreciate it. Thank you. Yeah, thanks very much. Thank you. Bye. Now, after the MRI scan, I know there's one tract that can be dealt with, and now I finally have answers. So it's amazing, absolutely amazing.
Come in. Hey, welcome back. Aha. Kaylee, how are you?
I'm all right, thank you.
Nice
How
to
are
meet you. Come
And
and have a
you.
seat for me. I wonder who does your tattoos.
Oh, it's not you, me.
Is it not?
It is.
How are you both? You all right?
Yeah.
How did you find your appointment?
Brilliant, thank you.
Really?
Finally, I've got some answers.
Given what you've been through, actually, and this is not to sort of underplay, you know, it's a surprisingly simple little picture once we look at the scans. It's just a little tube causing all this.
That's crazy.
Bother. There are, you know, new techniques. I mean, we can just sort of, what we call ablate the hole. So you can just put little things down it and fill it up. I mean, some people use glue, some people use lasers, some people use all sorts of different techniques to sort of block it up. Next thing that happens is that you're going to go back, see the consultant, talk through the different options about how that little tunnel can be blocked up, and decide which one you like the sound of and get on and do it.
Fantastic.
You know, that's all there is to it, really.
Wow.
And I hope that is the end of this saga for you. I really do.
Just
So do we.
get our life back, you know.
I mean, it's been tough for you. It's been really tough for you. But Kelly, I mean, it can't have been easy for you either, all this, can it?
No, it's been hard. Yeah, it's been really hard for both of us. More for you than for me, hasn't it?
It kills you. As a man, it kills you. You can't even look after your missus when she comes in from work. I can't contribute in any way. It's just not right.
And he feels very guilty about it, which I think is a bit silly.
Yeah, you know, I'm your partner. That's what partners do. They stick by you when you're ill, when you're not.
I know.
And I'm always there for you, and you know.
Oh, absolutely.
No reason
I'd
to
be
feel
lost
guilty.
without you.
I've never considered walking away. I've never considered leaving him. It's what relationships are. You're with each other for the long haul, whether you're ill or not. Until he's back on his feet, and then he owes me big time. See you later.
Thank you very much.
Pleasure.
Take
Bye-bye.
care,
Bye-bye.
thank you.
I absolutely idolise you, babe. I really do. You're my rock. You really are my rock. I'd be lost without you. Absolutely lost.
Glad to be okay.
Thank you.
So I've just arrived at 129 Harley Street to have my procedure done. So the procedure is now underway and I'm excited to see some results. Done my 6th session now, starting to see some subtle changes, which is excellent. I have been showing my husband, he's super proud, so we're hopeful, fingers crossed.